answer some questions. Swear that you're going to speak the truth.
Okay, my lord.
Say I.
I,
Say your names.
Dr. Agenda Rogers,
Swear by the Almighty God
swear by the Almighty God
that the evidence I shall give touching the matter now before court
that the evidence I shall give attaching the matter before court
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing else but the truth.
and nothing but the truth.
Doctor, you please repeat your full names.
I am Dr. Rogers Agenda.
May you spell agenda for court?
A-G-E-N-D-A. Yes.
You say you're 41 years.
Yes, my lord.
Where do you work?
I work with Psychiatric IHK.
You work with?
With Psychiatric IHK, International Hospital, Kampala, my lord.
Before IHK, what did you say?
I am age 41 years old, my lord.
The hospital.
I work with Care, Care, International Hospital, Kampala, my lord.
Who are you at Psychiatric International Hospital?
At Psychiatric IHK, I am a psychiatrist.
For how long have you worked as such?
I've worked as a psychiatrist for the past 4 years, my lord.
How about with Psychiatric IHK?
My lord, same time, 4 years.
Doctor, what are your qualifications?
I am a medical doctor. I have a master's degree of medicine in psychiatry, obtained in 2022
Master's
at
degree.
Makerere University.
Yeah, we are going to go by penny's speed.
Okay?
Yeah, yes. So you obtained this in which year?
2022.
Other than the master's, do you possess any other qualifications?
I have a bachelor's degree of medicine and surgery from Makerere University, obtained in 2010.
So for how long have you practiced medicine?
I practiced medicine, my lord, for the past 16 years now.
Mr. Mwaganya, we can now have interpretation.
Sure, my lord.
Ono musawo bamuyita Agenda Rogers nga wa myaka 40 egy'obukulu ng'akola n'eddwaliro erya Psychiatric ku International Hospital Kampala ntate musawo wa bwongo amaze emyaka 4 ng'ajjanjaba obwongo ate n'okubeera mu ddwaliro erya International Hospital Kampala amaze emyaka 4 obukugu ayina masters mu byobusawo ebyokujjanjaba obwongo nga yasomera mu University ya Makerere ate n'amala nga 2022 era yasoma degree esooka mu busawo n'agijja Makerere University nga yamala 2010 ate amaze emyaka 16 ng'akola omulimu gw'obusawo.
Doctor, what are your duties as a psychiatric doctor?
My Lord, as a psychiatric doctor, I receive clients at my mental health clinic at Psychiatric IHK. I assess them.
Let's go slowly, doctor.
Okay.
Just imagine we are writing.
Yes, my Lord.
So you receive patients at your mental health clinic
Yes.
at Sick Care.
At Psychiatric IHK.
Yes.
I carry out an assessment, a psychiatric assessment on these patients or clients.
Yes.
I diagnose mental disorders, if any. If there is a diagnosis, I go ahead and treat them with medication and therapy.
Yes.
Sometimes I am required on case-by-case basis to write a psychiatric report. Depending on the individual, sometimes can be work-related. Sometimes those reports can be required by court. Sometimes they are required for compensation purposes. That is it, my Lord.
Are you in position to recognize the accused person in
I
the
think
dock?
he can remove the mask first so that the doctor. Yeah?
Yes, my Lord, I recognize him.
You can put on back the mask.
How do you know him?
My Lord, he came one time to Psychiatric IHK as one of my clients.
What brought him to Sick Care IHK?
My Lord, he came to Psychiatric IHK after having been referred by the Ministry of Internal Affairs, Immigration Department. They had told him to get a sanitary medical report. To help him obtain citizenship in Uganda.
Doctor, Doctor, is this a general or unique requirement applicable to only the accused?
My Lord, this is a requirement for everyone seeking citizenship in Uganda by the Ministry of Internal Affairs.
Can interpret.
Mu mirimu gy'akola afuna abantu abajja mu ddwaliro ery'emitwe ku Psychiatric International Hospital Kampala n'abeekebejja obwongo n'akebera oba balina obulwadde bwonna. Bw'asanga nga balina obulwadde bwonna n'abajjanjaba ng'akozesa eddagala, oluusi ng'akozesa engeri endala y'obujjanjabi. Nti oluusi bamwetaagisa okuwandiika ripooti ng'amaze kukebera obwongo bw'abantu, oluusi nga baagala kubikozesa mu mirimu gy'abantu, oluusi nga kooti yeetaaga ripooti ezo, oluusi nga beetaaga ripooti ezo okuliyirira abantu. N'agamba nti omuvunaanibwa amumanyi nga yagendayo ku ddwaliro erya International Hospital Kampala ng'omu eyali agenzeeyo kumulaba, nga ab'ekitongole kya ministry ey'ensonga z'omunda nga bamusindiseeyo okufuna ripooti eraga nti yali omuntu eyali ategeera bulungi, ng'omutwe gwe gukola bulungi, asobole okufuna obutuuze mu Uganda. Nti kino bulijjo buli muntu ayagala okufuna obutuuze mu Uganda basooka ab'ekitongole ministry ey'ensonga z'omunda esooka kumusindika omusawo okumukebera oba omutwe gwe gukola bulungi oba nedda.
Doctor, did you carry out the sanity assessment on the accused person?
Yes, my Lord.
And after you carrying out that assessment, did you author a report?
Yes, my Lord.
To whom did you give the report?
My Lord, I gave the scientific medical report to Mr. Oyam Christopher Okelo.
And after that event, did anything else occur in respect of your client?
No, my Lord.
Eventually, did anything else occur in respect of the work that you had done on him?
Well, recently, CK IHK got a police request basing on one of their exhibits. That was a report written by me, so they wanted the hospital administration to verify. That number one, it was a report written by me. Also to verify that It is their headed paper and it's their stamp.
Yes.
My
Followed.
Yeah, my lord, when that happened, the hospital administrators reached me to verify if the said report was actually mine.
What did you verify?
My lord, I verified that the report was actually mine. After that, my lord, the hospital administration, through our CEO, wrote back to police concerning the same.
Why is it the CEO that replied the police request?
My lord, it is a policy of the hospital that any external request should be handled at administration level, not at the doctor's level.
Before your admin sent out the reply, were you required to do anything in respect of the report that you had authored?
My lord, after verifying that was actually my report, I countersigned it.
Are you in position to identify a reply from your facility, the sanitary report that you countersigned, and the police request that you are referring to?
Yes, my lord.
How would you identify?
Okay, that is, he can identify the police request,
Yes, my lord.
the sanitary report, and the reply.
Yes, my lord.
How would you identify the police report?
My lord,
The police request, sorry.
my lord, the police request has their logo on it, headed paper, and they had been signed by Madame, I think Madame Chelimo, if I remember very well.
About your sanitary report?
My sanitary report identified it by my signature, a CK IHK stamp, and it being on the CK IHK logo.
the letter forwarding your sanitary report.
My Lord, this letter too had the Psychiatric IHK logo. It had a CEO signature, Azasundo is his name, Azasundo. That also been stamped.
CEO is called who?
Azasundu.
Can you help me spell that?
A Z H A R, then Sundo, S U N D double O.
Let's have the interpretation.
Nti yakebera omuvunaanibwa era n'akola report eyo n'agiwa mwami Okero nti oluvannyuma ennaku eziiseeko emabega eddwaliro erya IHK International Hospital Kampala yafuna ebbaluwa nga basinzidde ku bizibiti bye baali balina abapoliisi ne abapoliisi baasaba nga bagamba nti okusinziira ku bizibiti bye baali balina waliwo ripooti omusawo ono gye yali awandiise ate nga baagala eddwaliro likakase nti oba ye ripooti eyo omusawo ono gye yali akoze era bakakase oba olupapula lwe baali bawandiiseeko lwali lwa ddwaliro ne sitampu y'eddwaliro. Oluvannyuma abakulu b'eddwaliro bamutuukirira okukakasa oba ripooti eyo yali yiye era n'akakasa nti eyo ripooti ye yagiwandiika. Oluvannyuma abakulira mukulu w'eddwaliro n'awandiikira poliisi ng'abategeeza ku nsonga ezo nti mu ddwaliro eryo bwe baba nga bawandiika omukulu waabwe yawandiika so si dokita. Bwe yamala okukakasa nti ripooti yayiye yasaako omukono gwe nti bwe baba bagimulaze ripooti eyo ne request n'ebbaluwa gye bazaayo ku poliisi asobola kubitegeera. N'agamba ebbaluwa yali esaba okukakasa yaliko akabonero ka poliisi ng'eri ku lupapula abapoliisi gwe bawandiikako ebbaluwa zaabwe nti ate omupoliisi gwe bayita madamu Kyerimo eyali agisayininze. Ripooti ye asobola kulabwako omukono gwe n'alaba stamp ya Psychiatric International Hospital Kampala n'alabako n'akabonero ka Psychiatric International Hospital Kampala. Ku bbaluwa eyali gye baali baddamu abapoliisi era agamba nti bw'agiraba agijjukirira ku kabonero aka Psychiatric International Hospital Kampala nti ate ne siginicha ya mukama waabwe gwe bayita Azasundu.
Please look at the document and tell court if you are in position to recognize it.
My Lord, I recognize the documents.
What are they?
Among the documents, my Lord,
Okay, you can begin by the first one, the
the
second,
first
and
one.
the third. The first one, what is the first one?
yeah, the first one is a reply from Psychiatric IHK. By our CEO, Mr. Azasundu. It was for the response to the
Dated?
request for the
Dated?
information. Yeah, it was dated the 10th April 2026.
What was the subject?
The subject was a response to requests for information Vide Gaba.
Gaba, does it quote the police reference?
My Lord, yes. Should I read out the response?
Yes.
Okay.
CRB what?
The CRB 026 stroke 2026 in brackets ref CID stroke C40 stroke 207 volume 44.
In short, what was your CEO forwarding?
My Lord, my CEO confirmed that the sanitary medical report that had been dated 30th December 2025 in respect to Mr. Oyum Christopher Okello was duly issued by International Hospital Kampala Limited, and also confirmed that was authored and signed by myself, Dr. Genda Rogers, a psychiatrist. In my capacity as their medical practitioner.
Okay, it had been authored and signed by yourself?
Yes. In my capacity as a medical practitioner at the facility.
Okay.
My Lord,
Okay. About the second document.
okay. My Lord, the second document is my sanitary report I wrote. It was dated 30th December 2025.
And the third document.
My Lord, the third document is the police request for information to support investigations at GABA CRB 026 stroke 2026.
Is it dated?
My Lord, this request was dated the 9th of April 2026.
Let's allow interpretation.
Tasobola kutegeera ebiwandiiko ebisatu bye bamuwadde. Ekisooka mukama we kye yawandiikira abapoliisi ng'addamu okusaba kwabwe. Mukama we bamuyita mwami Aza Sundu nga yagiwandiika ng'ennaku z'omwezi 10 Ogwokuna 2026 nti ebbaluwa eyo yali eddamu okusaba kw'abapoliisi mu musango ogw'eggaba enamba 26 Kasare 2026. Mukama waabwe yali awandiika kukakasa nti ripooti eyo eddwaliro erya International Hospital Kampala lyali lyagiwandiika nga 3 Ogw'ekumi 2025 nga baali bakebera bagiwandiikira Okero Christopher nti ate yali akakasa nti omusawo ono ye yagiwandiika n'ateekako omukono gwe ng'omusawo yali akolera ku ddwaliro eryo. Ekiwandiiko ekyokubiri gye bayita sanitary report oba ebbaluwa eraga nti omuntu yali ategeera bulungi era bagiwandiika nga 3 Omwezi Ogw'ekumi 2025. Ekiwandiiko ekyokusatu kyekyo poliisi kye yawandiikira eddwaliro nga basaba okufuna nga banoonyereza ku musango ogwagaba enamba 2026 Kasare 2026 nga bagiwandiika nga 9 Ogwokuna 2026.
Yes, Mr. Mwaganya, proceed.
So, Doctor, let's go to the report that you authored.
Yes, my lord.
When did you author the report?
My lord, I wrote the report on the 30th December 2025.
And who was your client?
My lord, my client was Mr. Oyum Christopher Okello.
What other particulars did you take for Mr. Okero?
My lord, I noted that Mr. Christopher Okello was a 38-year-old male. He was residing in Bunga. My lord,
Doctor, where did you get that? What was the source of that personal information that you took about your client?
my lord, Mr. Yum Christopher came to see me personally, so I took all the information from him alone.
So he say he told you he was a resident of Bunga. What else?
Mr. Yum, my lord, told me that you were single, not married. He was a Christian by religion. And at that time,
Doctor, we are writing.
oh, sorry, my lord.
And at that time,
And that time, he had a plan to settle in Uganda and start commercial farming.
Yes. What else?
My Lord, basing on his formal request of the sanitary report, I carried out a psychiatric interview on him.
Carried out a psychiatric interview. Yes.
I also carried out, after that, a mental state examination.
Let's allow interpretation.
Agamba reporter ye yagiwandiika nga 3 omwezi gwe 12 2025 ntate omulwadde we baali bamuyita Christopher Okero Onyum. N'agamba nti omulwadde we yali alina emyaka 38 egy'obukulu nga musajja nga yali abeera Bbunga, nti ebyo omwami Christopher ye yabimugamba era n'amugamba nti yali tali mufumbo nga mugoberezi wa Kristo. Ntate akaseera ako yali ayagala kutandika kubeera mu Uganda nga akola bizinesi y'obulimi oba okulunda, nti era okusinziira nti yali asabye okukola report okulaba nti omutwe gwe gwali guteredde oba gukola bulungi. Yagezaako okwogeramu naye alabe omutwe gwe oba gwali gukola bulungi oba nedda. Oluvannyuma n'amukebera okulaba obwongo bwe bwali bukola bulungi oba nedda.
Doctor, what does this psychiatric examination entail?
My Lord, a psychiatric interview entails asking the client many times open-ended questions. The interview the interview entails asking various psychiatric conditions, psychiatric questions, sorry, with the aim of...
Doctor, I heard that it entails asking the client many times open-ended questions. That's where I stopped.
Yes, psychiatric questions with the aim of trying to enlist if this client has any mental disorder.
So in this case, what did you do?
My Lord, upon asking him those questions, Mr. Yum told me the following. Mr. Yum told me that he has no history of having excessive sadness, he has no history.
Let's go slow, doctor, as I advised.
Doctor, is that all that on your report, or?
Yes, my lord.
Okay.
Should I continue, my lord, with the same? Okay.
Yes.
Yeah.
No history of excessive sadness.
He had no history of loss of interest in pleasurable activities.
Sorry, kindly repeat that. He had no history of having excessive sadness.
Yes, my lord. He had no history of loss of interest in pleasurable activities.
Yes.
My lord, he also had no history of excessive fears or excessive worries. He had no history
Worries.
of worries, yes.
I shall be prompting you.
Okay.
No history of excessive fears.
Or worries,
Worries.
yes.
Yes.
He had no history of excessive happiness or increase in goal-directed activities.
Increase.
Increase
In.
in goal-directed activities.
Okay. If I may pause a little there.
Or interpretation first.
Okay.
nti okumukebera obwongo nti bamubuuza ebibuuzo bingi nti ebimu bamubuuza okulaba nti oba omutwe gwe gukola bulungi oba nedda nti musango guno ng'amaze okumubuuza ebibuuzo ebyo bye bababuuza yamugamba bino yamugamba nti yali tafunangako okunyiiga okusukkiridde era nti teyafunangako okubeerawo nga takyayagala kwetaba mu bintu ebyessanyu nti era yali talina okubeerawo ng'awulira atidde nnyo nnyo oba yeeraliikiridde nnyo nti era teyalina ekiraga nti yali asanyuka nnyo 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 oba okubeerawo ng'ayagala kukola ebintu ebisukkiridde.
Doctor, why were these questions important in your professional assessment of your client?
My Lord, these questions help us to establish various mental disorders, if any, in any client that comes before us.
Okay.
Continue. My Lord, he had no history of...
Just a minute. How do they help you? The court would want to know why, for example, you focus on excessive sadness or interest in pleasurable activities or excessive fears and worries or excessive happiness or excessive goal-oriented activities. Why is this particular direction important to you as a profession in determining or detecting mental disorders?
My Lord, these questions are key to the various mental disorders. For example,
Mental disorders. Yes.
when I ask a client if you had history of excessive sadness or loss of interest in pleasurable activities,
Yes.
I'm trying to elicit if you have depression.
Okay. Yes.
If I ask about fears, excessive fears, or excessive worries, I'm trying to elicit if you have an anxiety disorder.
Yes.
The question I asked about excessive happiness or increase in goal-directed activities, I am trying to elicit if the client has bipolar affective disorder.
Has
Okay.
what? Sorry.
Has bipolar affective disorder.
Affective.
Affective disorder.
Okay. So other than that, what else did he reveal to you? Or did you ask him?
My Lord, he also told me that he has no history of hearing voices. Or seeing things other people could not see. When I ask that, my Lord, I'm trying to elicit if you have hallucinations.
Okay.
My Lord, he also told me that he has no history of using illicit drugs like cannabis, however, he occasionally used alcohol. My Lord, that helps me to elicit if someone has a substance use disorder.
Yes.
He also told me that he has no history of having had any traumatic experience in his life. That is a question that can help me elicit if someone has what we call PTSD.
If somebody has
PTSD,
which is
it's post-traumatic stress disorder.
proceed.
My Lord, the client told me that I was the first mental health personnel he has ever seen in his life.
What did he say?
He told me that I was the first, this was the first visit to a mental health personnel in his life.
And how did you reflect that in your report?
Pardon?
How did you reflect that in your report?
If I get what you're saying,
Yeah, what did you write? How did you report that information in your report?
this is the index visit to a mental health personnel.
What? Index vis.
Yeah, index visit, the first visit to a mental health personnel, my Lord. And that he had never taken any psychiatric medications.
He had never taken any.
Psychiatric medication, my Lord.
What else?
My Lord, the client disclosed that was a patient of a chronic medical condition, sickle cell disease, and that he was regularly taking medication for that purpose.
Anything else?
Yes, my Lord. Mr. Yum told me that he was the third born of 4 children, that his parents are alive and they are well. He also told me that there was no history of any mental illness in their family.
Okay. Let's allow interpretation.
Agambye nti ebibuuzo bye babuuza abalwadde abajja mu ddwaliro yaabwe bya nkizo nnyo okusobola okutegeera bulwadde ki bw'omuntu bw'alina ku bwongo bwe, okugezesa bw'abuuza nti wali obaddeko awo n'owulira ng'onakuwadde nnyo n'owulira nga tokyayagala kwetaba mu bintu ebyessanyu, aba agezaako okulaba omuntu oba alina obulwadde bwa depression oba okubeera ng'omuntu munakuwavu buli kaseera. Bw'abuuza nti oba omuntu abeera awo n'awulira ng'atidde nnyo oba yeeraliikiridde nnyo, aba ayagala kulaba oba alina obulwadde obw'okweraliikirira nnyo oba anxiety disorders. Nti era bw'abuuza oba omuntu abadde nga aba awo n'abeera nga musanyufu nnyo oba nayagala kukola ebintu ebisukkiridde, aba ayagala kulaba oba omuntu oyo alina obulwadde obunene obukosa obwongo ate nga bwo bulwawo okuwona, obwe bayita bipolar affective disorder. Era yamugamba nti yali talaba bintu oba kuwulira ebintu abalala bye batawulira, n'agamba era yali takozesa biragalalagala ng'enjaga oba ebirala. Naye n'agamba nti obw'olumu yali anywa ku mwenge, nti okulaba nti oba era ebyo byonna bimubuuza okulaba oba yali alina obuzibu nga buva mu kukozesa ebiragalagala. Nti era yamugamba nti yali tafunangako okuyisibwa bubi oba trauma, era bw'aba amubuuza ebyo aba ayagala kulaba oba yali afunnyeko okuyisibwa bubi ate ne kimukosa, kye bayita post traumatic stress disorder. Nti era yamugamba nti gwali mulundi gwe gwali gusookera ddala okulaba omusawo w'obwongo mu bulamu bwe, era n'agamba nti tanywangako eddagala erikwata ku bulwadde bwonna obw'obwongo, naye n'amugamba nti yali alina obulwadde bwa nalubiri oba sickle cell, nti ate yali ali ku ddagala ly'obulwadde obwo. Era yamugamba nti waka yewakusatu mu baana abana, nti abazadde be bakyaliwo ate bali bulungi, nti ate mu kika kyonna talinayo gw'amanyi nga alina obulwadde bw'obwongo.
So, doctor, apart from what your client disclosed to you in the interview, did you proceed to carry out your independent mental examination on him?
My Lord, I proceeded to carry out a mental state examination.
Yes.
My Lord, from this examination, I noted that Mr. Oyum Christopher was a middle-aged man. He looked kempt.
Was a middle-aged
man. He was kempt and was well nourished.
What do you consider to declare somebody well nourished, just for the record, in your medical profession?
My Lord, he looked healthy, I could say. He never appeared sick in any way, physically. That time I saw him.
Okay, you say he was well nourished. Proceed.
My Lord, I noted that he was calm. He kept eye contact. And he had no odd behaviors.
No?
Odd behavior. Odd.
Why was this important for you to observe?
My Lord, odd behaviors, they help us to know if this person could be acting that this person could be acting under the influence of probably voices he's hearing in his head, or could be seeing things others could see.
Yes.
Yes.
Let's have the
Interpretation. my lord.
interpretation, please.
nti bwe yamala okumugamba ebyo naye yongerayo n'okumukebera obwongo era mu kukebera n'alaba nti yali musajja akuze ng'alabika bulungi ate nga talina bulwadde okusinziira bwe yamulaba yali mukakamu ate ng'omuntu bw'aba ayogera asigala ng'amutunuulidde yali talina enneeyisa eyali teri ya bulijjo. Kino kituyamba okumanya oba omuntu yali akola byonna bye yali akola nga awulira amaloboozi oba okulaba ebintu abantu abalala bye baali tebalaba.
Proceed, doctor.
My Lord, I also noted that his speech was coherent, it was of normal rate, it was of normal volume, and it was of normal tone. I noted that his mood was athymic.
You noted that
His mood,
before the mood. I'm interested in you following the report
okay,
in the order it appears.
okay,
Yes. After the speech.
okay. My Lord, I noted that his thoughts were logical, with no preoccupations, no overvalued ideas, and no delusions. My Lord, he had
Okay. No overvalued ideas and no?
delusions, my Lord.
Okay.
Yes.
My Lord, he had euthymic mood,
He had
euthymic mood, EUTHYMIC. That's what we call basically a normal mood.
yes.
This was congruent with affect. That means they match.
Congruent first.
Congruent with affect.
Could you please spell that word?
CONGRUENT.
Which means, which was
congruent with affect.
With affect, meaning
That both the mood and the affect are in agreement.
yes.
Doctor, would you help us understand what affect means?
Affect, for example, is your current emotions. For example, if I look at you, your facial expression, I can tell that you are sad or you are happy. That is affect. While mood is a sustained emotion over a certain period of time.
Mood is what? While mood is a sustained
emotion or feelings over a certain period of time.
Yes. From affect.
My Lord, Mr. Hume had no perceptual disturbances. And he also had no cognitive disturbances.
I'm still going to ask you to help court appreciate what you mean by perceptual and cognitive disturbances.
My Lord, perceptual disturbances are in line with if you are having abnormal sensations, like for example, you are hearing voices, others are not hearing them. You are seeing things.
Let's go slow, doctor. For example, hearing.
You are hearing voices, others are not hearing them. You are seeing things, others are not seeing. Why cognitive disturbances? There we are looking at your memory. You are looking at your attention span.